Here we go.
Okay, we got it.
Sorry, I'm new to this Instagram thing.
Oh, no worries. When technology works, it works great. When it doesn't, it's a disaster. So
No
so if
worries.
you
Sorry for the delay.
oh, no worries at all. If you're just joining us right now, Callie Umar here from Insauga.com. I'm here with Dr. Lawrence Lowe, the Chief Medical Officer of the Region of Peel. If you have any questions, please ask it below. A lot of people are joining us now, so I'm gonna ask questions. I'm gonna throw questions at you if you don't mind.
Sure.
Um, Can you define what an outbreak is in a long-term care facility, please?
So outbreaks in general, and specific in a long-term care facility. So I'm going to define this in two ways. When it comes to an outbreak, usually what an outbreak is you have a greater number of cases of a disease than what you would expect, right? So a lot of it has to do with what you understand about typical patterns, trends. So for example, one case of the seasonal flu is not necessarily an outbreak now, but if you have like hundreds or thousands of them, then you're wondering about that. In the case of a disease that is as new as COVID-19, we are very strict and conservative on the definitions. So in long-term care facilities, right now, the current definition we're working on is that one case of COVID-19 in a long-term care facility, either a staff or a resident or anyone, that constitutes an outbreak that requires immediate action to address.
Okay. What is the communication protocol for public health and long-term care homes in letting the community know about the outbreak?
So in terms of that, we actually post all of the homes that are currently on outbreak on our website. You can go to peelregion.ca/health/professionals/alerts. I know it's a whole bunch of wieldy slashes, but there it'll actually identify, and it's not specific to COVID alone, but certainly I know that's the main reason why people are looking. It will identify the institutions that are currently in outbreak and what was the causative agent that was identified and what are the precautions that we have directed and are working with the home to put in place to slow the transmission of the disease, essentially.
Okay. But what is the communication protocol, though? I was talking to a friend today that actually had a father the father is in Eatonville, where 25 people passed away from COVID-19, and he didn't get information until he got it from the media.
Oh, geez. Yeah, no, that certainly concerns me as well. Typically, the onus for communicating lies with the home that's in question. That said, I mean, I can imagine certainly with what's happened in Eatonville and what you're seeing in many long-term care facilities in the province, some of them are absolutely overwhelmed, just probably short-staffed and really just trying to take care of all the residents as best they can in these situations. So I can't speak for the specific situation in Eatonville, but I know that many long-term care homes that we partner with would certainly make their best efforts to try to inform families in a timely manner. It's really I really regret to hear that your friend found out about it that way.
So if you're just joining us right now, we are here with Dr. Lawrence Lowe, the Chief Medical Officer of the Region of Peel. So if you have any questions, so these are a lot of questions that I've gotten from people because we did some marketing that you're coming on the show. So I'm just going to read them up. Okay. What is the protocol in place for long-term care homes when someone who handles food for residents are tested positive for COVID-19?
Yeah, so typically in the case when a staff member tests positive for COVID-19, that is an indication for us to go in and widely identify who else may have been exposed to that individual. It's not necessarily just a matter of handling food, but it's a matter of the interactions as well. So did they speak to a number of people? Did they have prolonged close contact with other employees, for example? And then essentially we would identify all the people who would need to be tested to make sure that they don't have COVID-19. And then basically identifying potential residents who may have contracted the disease from the individual and making sure that they're cared for and held away from the general population of the long-term care homes so that there's no spread that way. And then also similarly with staff members, ensuring that they are off work until they test negative, or they're working with appropriate personal protective equipment and only working on COVID positive residents, like that sort of work. I mean, the big thing is anyone, whether it's someone handling food or a nursing home staff or an administrator who tests positive, immediately triggers an investigation on our part in public health to try to stop the spread.
Okay. What are the measures taken to protect nurses and frontline healthcare workers from this virus?
Absolutely. So there have been a lot of measures that have been taken. I will state at the outset that one of the most important things that we can do to help protect frontline healthcare workers indirectly, and every single person in the region can do this, is to stay home, right? So if we're staying home, if we're staying, reducing our interactions to only just the essential trips like groceries and medical attention and, getting pharmacy, getting prescriptions, that will actually help to slow the spread in the community, which will slow the number of COVID cases, and then it'll keep our frontline workers, both in retirement and nursing homes, but also in hospitals and healthcare settings safe, because there'll be less COVID essentially that they'll have to treat. But specific to what actually happens in a long-term care home, there are a lot of procedures that have taken place, and it's a long list, but just to give you an example of some things, many long-term care homes have reduced visitors, for example. It's not just every visitor can come in, it's absolutely essential visitors and in critical situations. Many of them have put in enhanced infection prevention and cleaning protocols, and many of them have been requiring things like personal protective equipment, particularly when caring for a resident that may have COVID-19, increased hand hygiene, all these other pieces to really, and also, as I mentioned, broadening testing, all these things to really just make sure staff are safe and also not necessarily spreading the virus as well.
If you're just joining us right now, I'm here with Dr. Lawrence Lowe, the Chief Medical Officer of the region of Peel. If you have any questions, ask it below, and we'll try to get to it. Does Peel Public Health report on multiple cases in one home by updating their website?
So at this time, we're basically continuing to update the website with the specifics of the home. Because of the challenges is that many of the homes have really small numbers, particularly 1 or 2 people. We're holding off on updating cases at this time because it could be potentially identifying, particularly for people who might be familiar with the home. But for the most part, when we will be starting to actually put out data on at least on passings, unfortunately, in long-term care facilities, just to sort of give a broader understanding of how this outbreak is unfolding. It really is important, I think, for the public to at least know that statistic, to really understand why it's important for us to all be doing our part in staying home at this point in time, keeping this out of our long-term care homes as we can.
I'm sure you guys are busy.
Yes,
yeah.
Absolutely. Absolutely. Yes. Sorry, I was just seeing this other question that popped up down here, which is about outside service providers deemed essential, and going into multiple facilities. Actually, that's something that's being explored right now. I know that they've actually put in a provincial order recently that is going to limit in-house staff to working in one facilities. A lot of these other outside service providers is something that we're actively looking into, and we're trying to come up with guidelines to figure out how we can assist our administrators in making sure that they're also not necessarily carrying the virus, and also ensuring that they're also protected when they're going into these homes, particularly some that may be on outbreak. So, but you were saying something about me being busy.
Yeah. With what you were saying, how fast can we get these measures in place?
So many of these, yeah. Sorry, go ahead.
No, we're talking about it now. Doug Fort's talking about it. Everybody's talking about it now, right?
Right.
How fast can we get these measures in place? And that's, to save lives.
Yeah, Kyle, it's a great question. So in fact, we actually had most of these measures in place even before the arrival of coronavirus in our community. So about a month or a month and a half ago or so, many long-term care homes were really starting to really given the advice and the recommendation, especially once we started seeing community transmission within the region, to just say, now's the time to essentially be, building what you've heard in the provincial milieu about an iron ring, really sort of trying to set up so that you're ready to, fight off this virus and make sure it stays outside of these establishments. Really what we're doing now is a broadening of our response to be more actively seeking out our partners and saying, hey, what help do you need to make sure that everything's top notch, and making sure that you're actually taking all the steps that you can to reduce transmission, and also for the houses that are already in outbreak, taking those critical steps to actually identify who and what needs to be isolated to make sure that we're breaking the chain of transmission before it goes too far.
Okay. Why are test results taking up to 7 days to get back?
Yeah, so that is a good question. There's been a lot of frustrations around test results, absolutely. But as I understand it, a lot of that was driven by the provincial backlog, which has since been cleared. Just a few days ago, I think the Premier announced that the Public Health Ontario lab had gotten through the backlog. There's a lot more capacity online right now, and so I'm hopeful that we'll be able to get results in a more timely manner. The other thing I'll mention while I can is that there's also a way for you now to check your results online, and that just went live a couple weekends ago. So if you go to covid19.ontario.ca, there's actually an online results portal where you may be able to check it faster than we're getting it at the public health unit. So,
okay.
Yeah.
So if you're just joining us right now, I'm here with Dr. Lawrence Lowe, the Chief Medical Officer of the Region of Peel. So if you have any questions, type it down below and we'll try to get to it. 8 employees at the Toronto Public Health Headquarters tested positive for COVID-19 a couple of weeks back. With Peel Public Health being under one roof, are you afraid of an outbreak, or are you thinking of more of an at-home solution for your work?
This is a great question. I actually directed about a month ago that all of our employees should start working from home.
Okay.
I've actually sent as many employees as I can home now. For obvious reasons, there are certain employees, just by virtue of our processes, our call center, various processes that still need to be on site. But what we've done is, since we're all under the same roof, we've taken the floors that used to house hundreds of employees, and now we've basically spread like 40 or 50 employees out all through it. So we're actually practicing physical distancing even on site right now. And I would encourage any of the businesses that still remain open, even if you're an essential business, physical distancing is a critical thing that you should be doing. You should be limiting the number of people in your stores, limiting the number of people outside, even to the extent that you can try to move to things like just pickup and delivery. That will go a long way. I'll give you an example. I took my car to get snow tires done. This is at the early part of the outbreak. Before the orders came down, and actually cars are still considered an essential service. But even then, my mechanic was already taking great steps. So he was just like, slide it through the slot, and then when you're done, bring your spare key, and then I won't even talk to you. You can pay me online. So, to the extent that you can change your business model to reduce interactions, that will help to reduce spread. And we've taken those steps at Peel Public Health. Okay.
A couple of questions we're going to take from our viewers here right now. Does freezing or heating kill the virus?
So at this point in time, there is some suggestion that that the virus may actually be more heat stable, because there's a lot of people who are like, is this going to be gone by summer? As you can see, there are many countries in the world that have hotter, more humid environments, and they are also still experiencing the same transmission of this virus. So, and as you know, when the virus first emerged, it was January in China, so it was pretty cold. There isn't really any suggestion at this time that it's temperature labile, but certainly it's a new virus, and as we continue to monitor its trend in our community, hopefully we'll have more information. Hopefully we'll have more information in the months to come.
Okay. I know just senior living centers are a very hot topic right now with everything that's going on. Now, is everybody at senior living centers being tested for COVID-19?
I think that's actually been the aspiration of the Premier. He's actually said that he'd like to see more proactive testing around the province. Certainly we are being careful, at least in our perspective as a health department, because there is, testing is still a resource. Now, there isn't a shortage, but it is a resource, and you start throwing a whole bunch of swabs through, and you're going to burn through them pretty quickly. So what we are trying to identify is trying to come up, as I mentioned, in our broader response around seniors settings, to really come up with sort of a smart protocol to identify. So it's, we may test certain people who are tested as close contacts of a case, but we may actually cast the net a bit wider. But I don't think we're going to just go systematically through every single retirement home and test people, because the challenge with that is, as I mentioned, we'll burn through swabs a bunch. But B, the challenge is you could test them all on Tuesday, and then someone comes in on Wednesday and has the virus and inoculates a bunch of people. So then basically you've now had this situation where you've actually tested them and now you're not necessarily catching it. So, so to a large extent, it's about trying to test broadly, but testing smart as well. So that's what we're working on our strategy.
Okay. As far as testing kits go, is there a way to get tests out faster, or are you guys working on technology that will get it out faster?
So there's both is the answer to that question. I know that the federal government has just approved a rapid testing kit for COVID-19, which is exciting. I also know that our provincial partners